Good morning, everybody. Welcome, everyone, to this briefing happening at MSF headquarters in East Africa. And to all those joining us online today, which is everybody. My name is Fatuma Abdullahi, Communications Advisor for MSF, and I'll be moderating today's press briefing. Today, we're presenting the new report titled They Killed Them While We Were Running, which documents the escalating violence affecting civilians, repeated attacks on healthcare, and the rapidly shrinking humanitarian space across the country. So the report is based on medical data, first-hand testimonies collected by our teams across multiple locations in South Sudan, and it paints a deeply concerning picture of the crisis that is intensifying. Before we begin, I'd like to explain the structure of this press briefing. So we will first hear from our speakers, who will speak for about 10 minutes each. And then after that, we will give the floor for journalists to ask questions. Not here in the room, but yeah, online. And then we will get back to you with the answers. So without further delay, I'd like to then introduce the speakers, and after that, we'll play a short video. To my left is Abdallah. He's our regional desk manager for MSF, overseeing operations in South Sudan, Sudan, Chad, Kenya, and the Horn of Africa. He has more than 17 years of experience leading humanitarian operations across East, Central, and West Africa, as well as the Middle East, particularly in context affected by emergencies and armed conflict. Next to him is Helen Richards. She's a humanitarian affairs advisor for MSF based in Nairobi with over 15 years of experience in humanitarian response and project management. She follows Sudan, Ethiopia, Somalia, South Sudan, and Nigeria. Helen has worked in project management and political, humanitarian, and operational landscapes, shaping crisis responses. She's particularly focused on South Sudan, where she serves as a focal advisor for humanitarian affairs and has closely followed developments in the country for several years now. Next to Helen is Zakaria. He has served as head of operations for MSF in South Sudan for the last 2.5 years, overseeing the response following the escalation of conflict in 2025-2026 and its impact on the affected population. He brings over 21 years of humanitarian experience in emergency settings worldwide, with extensive field experience in complex crises and strong regional insight, of course, as a Kenyan national. Next to him is Gul. He's a senior humanitarian leader and operations manager with MSF, overseeing multi-country operations in South Sudan, Ethiopia, Nigeria, Uzbekistan, and Tajikistan. He has over 20 years of experience managing complex humanitarian responses across Africa, Central Asia, and Middle East, with a strong focus on emergency response, access, security, and principled operational leadership in conflict-affected environments. We will now play a short video from South Sudan.
Ranyatin. Kita na ada kona cemi ye dah bilbeli udah. Isi cup kajan. Bil cup berada yang mata jauh berada tora. Mona ada yang dah macam wah ciji ku iya na bum, iya na ciji kebi. Siapa kaya loja, bitinnya tiada konten nyam dah, bukan tuan nyam dah. Bukan tu jen mandi cikan besok. Kau saya yang alihat penci, yang aliu ni jen begad bukan doa. Yang tak ada kena, tapi telo orang di telo orang tak. Telo dua wala tiap, telo dua wala. Dua wala ada sini orang kecil cula ni langkan. Telo dua wala dia. Tapi nu ya kalau ada orang dua wala, dah kecil gua. Anda muka awak yar kalau orang dulu begad ada kona cedah. Kayak buat sih kami wina aku dah tu. Alah saya lokon nyal. Selo kan ni ada aku ada wiyot. Selo kan kan ni redo arbang. Selo kan macam.
Lokon mana?
Macam ni pam. Kan ni kan jen. Kan macam kan. Bina lo aku iri kiri. Ni lah mau ni ada orang ngatin lah. Baik lah mana wida. Tapi yang ayuh cium mir ti jawar bang ayuh cium dah anga yo chiriao nei ri kon ko daga na bo kana kai ge ti pon ga yele la pon kabran be kala bi kliaran yo ta ko ne me yo kabran be riang til mala na je mi che cha wo biliu mi che cha wo bitu nyanta bai nan te kana.
Okay. I'll now ask Abdullah Hussein to present the key context and opening overview of the crisis in South Sudan. Abdullah.
Thank you very much. Thank you, Fatuma, for the introduction. I would like to thank everyone who is joining us in this press conference and sharing of this report. I would like to start with the title of the report. It's titled, "They Killed Them While We Were Running." This report documents the violations and the violence against civilians that MSF teams have witnessed across South Sudan since mid-2025. The title of the report comes from directly the words of the patients and the people that we encounter in the communities affected by armed conflict in South Sudan. This title was said by a woman, an elderly woman from Lankien. So it's a direct testimony from the field. It's a deeply alarming situation for the civilians in South Sudan. Since the beginning of 2025, we have observed a resurgence of armed conflict between the government of South Sudan and the Sudan People's Liberation Army in opposition, also known as IO, and different armed groups that are allied to them. I would like to highlight to you the main violations that our teams have witnessed and that we have either witnessed with the patients that we treat or in the communities that we assist. They include indiscriminate violence, including bombardment, deliberate killing of civilians, forced recruitment, abductions, and widespread sexual violence. This is unacceptable and constitutes a violation of international humanitarian law. Since 2025, we, in the state of Jonglai, there are 300,000 people estimated that have been displaced according to the United Nations. To our knowledge and in the public reporting, there are 2,000 people that were killed in this conflict, 1,600 injured, and there has been a widespread sexual violence committed against civilian population. I have to say that this report, these figures are underreported because of the complexity of the situation in South Sudan and the changes in the context. This resurgence, I wanted to give you an example of one of the latest locations where was affected by conflict in Akobo. In Akobo, MSF used to operate there since 2025, mid 2025, and there it was a county of roughly, at least in the east, 200,000 population. In early February, early March, there has been IDPs that were coming from different areas in Jonglei State, especially in Nyarol County. These IDPs there were different estimations, but our teams have observed in early March that were huge number of displaced people in the town of Akobo and in the eastern side of the county. In the mid-March, we were provided with ultimatums, 72-hour ultimatums to evacuate, and most of the humanitarian organizations left. We went back to Akobo in March 2027. At the end of March, we found the hospital that we used to support, which was a teaching hospital, treating not only the wounded people in the conflict, but also the civilians, completely stripped of any semblance of health facility. So the stocks that we have had in that facility was looted. The hospital was vandalized. Of course, all the humanitarian organizations were also looted. We, in that same moment, have gone to Tiergol, which is over the border to Ethiopia, and there were 115,000, according to the counts of our teams, people that were displaced, all of them on the top of each other, without shelter, without assistance. You can imagine the situation there, where humanitarian capacity has been completely destroyed and vandalized and dismantled, but also that you have a huge number of population that are displaced. This is not an isolated case. It is one of the examples of violations that we observe in South Sudan. I wanted to read for you one of the testimonies of the people that we encounter, or actually our own staff that are fleeing in the conflict. All the community, the children and the women fled. Some of them died on the way. Some children drowned. Some elderly people with disabilities were left behind. People were killed. The water system was destroyed. At least I know 3 people that died of hunger and lack of water. We left them behind. That's accounts of the people that are fleeing in the armed conflict in South Sudan that we observe. This escalation is on the top of a crisis that already existed in South Sudan. As you know, there is 1.2 million people, including returnees and refugees, coming from Sudan that were arriving in South Sudan since the war in Sudan began in April 2023. These people are of course sharing whatever the local community has in different locations in South Sudan. There is 5 million people that are also facing a food insecurity. That is 1 in 2 people in South Sudan. And of course, there is the reduction of the aid in South Sudan that has been going down since the beginning of 2025. This account is, of course, what we today sharing with you in this report are testimonies directly from the field, from our patients, from our staff, from community members, and it's not an isolated account. It's what we observe in different areas in South Sudan. Our fear is that these kind of violations are normalized, and that the violations against civilian population, against healthcare, becomes the normal in South Sudan. Thank you very much for your interest and for joining us today in sharing with you this report.
Thank you, Abdallah, for this important overview and setting of the context and the alarming humanitarian situation civilians are facing across South Sudan. I would like to now invite Helen Richards to take us through the key findings of the report, including testimonies she collected firsthand from patients, communities, and survivors affected by violence in South Sudan. Helen.
Hi, everyone. Thanks for joining us today. So I was in South Sudan in March, interviewing people for this report, and the stories we heard were very hard. I was in Malakal, where I met a woman and two of her children. She and her teenage daughter had been shot when their village in northern Jonglei was attacked. She was 9 months pregnant at the time, and she couldn't run. So when she sat on the ground, she was shot, and a bullet hit her abdomen, and it injured her unborn baby. She managed to reach Malakal Teaching Hospital, where MSF is supporting surgical activities, and their surgeons managed to save the life of her and her unborn child. But when I spoke to her, she said she had her two children with her, but she said, "I don't know where the rest of my children are and what happened to them in the attack." And this story is sadly very far from unique. So the report that we're releasing today really details the kind of brutal and horrific violence that we're seeing across the country. So Médecins Sans Frontières, we're working in over 18 different locations since the beginning of last year, January 2025, in South Sudan. So across 6 different states, 2 administrative areas. And across these locations, we're seeing an increase in violence. So we care for more than 6,000 patients injured or who experienced different forms of violence since the beginning of January last year. This includes people injured in airstrikes, ground attacks, gunshots, and sexual and gender-based violence. We saw across our projects a 77% increase in gunshot-related injuries last year. And in some parts of the country, this was much higher. For Malakal, for example, we saw a 700% increase in the number of patients we saw with gunshot-related wounds, over 250 patients last year alone. 1 in 6 of every of these patients is a woman or a girl. In some areas, that figure is even higher. For example, in Lankien, 55% of the patients we treated who'd experienced some form of violence were women and girls, 1 in every 2. And I think it's important to add that this increase in violence comes at a time when MSF has increasingly limited access to different populations. So since the beginning of 2025, we've had to suspend or close operations in 6 different locations. And despite this, we still see an increase in violence across the country. And there are real people behind all of these statistics. I was also in Chwil in March, which is a village on the border between Jonglei and Upper Nile State, which currently hosts over 30,000 people who've been displaced by violence in Jonglei and Upper Nile in recent months. And there we spoke to dozens of people who've fled violence from many different locations across Jonglei and Upper Nile, including Akobo, Lankien, Pieri, Wagak. And people told us the same types of stories again and again. We heard reports of aerial attacks, ground attacks, rape and killing of civilians, and burning of houses. And I think what was particularly haunting was the consistent stories of people told of being attacked while they ran away from violence. And so people who couldn't run, the elderly, people with disabilities who weren't able to run, there were horrific stories of people being left behind, killed, and also burnt inside their homes. One man told us his experience of fleeing Lankien. He told us soldiers went into the houses looking for people. They shot people inside, including women and children. They killed my mother. She was 60 years old. They killed my brother, my brother-in-law, and my uncle, all of them. Another woman told us that she can't sleep because she still has the image in her head of her grandmother, who was too infirm to run, burning inside her tuku. And these stories are not isolated incidents. They're part of a broader trend of violence that we see across the country, which is escalating as conflict intensifies. Across the whole country, women and girls are living in fear of sexual and gender-based violence. This isn't new, but as conflict escalates, so does violence, including sexual and gender-based violence. And since the beginning of 2025, we've cared for more than 2,000 survivors of sexual violence in South Sudan. 96% were women and girls. Some were children under the age of 15, and many talk about being attacked by multiple perpetrators from all parties to the conflict. One MSF health worker in Yei told us about a patient that she cared for. And she told us on Friday night, she arrived, she'd been gang raped by a group of men. She doesn't know how many. She came to us for treatment. After treatment, her grandmother took her back to the village where she thought she would be safe. On the Monday, she went to collect firewood alone. She was raped by an unidentified armed man, and she was back in our clinic on Tuesday, 4 days later. So no woman should have to survive this kind of violence, seek medical care, and then be assaulted days later because nowhere is safe. And these are, as I said, these are not isolated incidents. We're seeing them across the country. What, though, perhaps is more unique about these stories are stories of people who've been able to access medical care. And that is not a reality for most people across South Sudan at the moment, where health facilities are dysfunctional, not open in many areas of the country, and conflict and violence is making access even more difficult. For example, across Jonglei and Upper Nile states, in opposition-held areas, there's now no hospital that offers surgical capacity. So if you're a woman in need of a cesarean section, you don't have anywhere to go. I've been doing this job and working on South Sudan for quite some time, and I think what worries me now is how normalized this level of violence is becoming. So like no act of sexual violence or attack on a civilian is ever acceptable. But what we're seeing now is attacks at scale in multiple locations. And yet there is very little attention, very little outcry about what is happening. I think we're concerned that we see a mounting disregard from all parties to the conflict around civilian life. But there's very little outcry. So this is why we're releasing this report today, to detail what we're seeing, the stories of our patients, and the concern across different parts of the country. And we're calling on all parties to the conflict to stop attacking civilians, to uphold the obligations they have to protect and respect civilian life and infrastructure. But we're also calling on international donors and actors to step up their engagement on South Sudan and to express condemnation for what is happening, which we have not seen as the situation warrants. Thank you.
Thank you, Helen, for the testimonies particularly, and for bringing the human realities behind the report's findings to the forefront. What we've had today is not only about numbers or trends, but about devastating impact of violence on civilians, families, and entire communities across South Sudan. We will now hear from Zakaria Mwatia, who has worked in South Sudan over the last 2.5 years and has witnessed firsthand the escalation of violence and growing barriers people face in accessing healthcare, and particularly in Upper Nile State. Zakaria.
Thank you very much for attending this briefing this morning. I have been working in South Sudan for the last 2.5 years, and I bring you first-hand information. I bring you field realities, what we have witnessed, what we have experienced, and what we have continued to see unfolding in South Sudan. I will speak about how we see violence escalating and how the civilians are being affected. And in the last 2 years, if we compare, we have seen a huge escalation of violence in general, but in particular also a huge escalation in airstrikes. In 2024, only 2 airstrikes were reported. However, in 2025, 138 airstrikes have been reported in different locations in South Sudan. Looking at 2026, already between January and March this year, 18 airstrikes have been reported. And the scale has really increased, is exploding. And apart from these airstrikes, we have witnessed and treated many survivors in the facilities we support across South Sudan. Along the Sobad River, in March 2025, we received 34 wounded patients. And among these patients, they included 11 people with severe burns. And one of them was a 70-year-old woman with the burns covering 90% of her body. Such a burns, the chance of survival are very rare. And we received 34 patients in our hospital in Ulang. After the health facility north of Ulang called Quich was sheltering, the villagers ran to this health facility hoping that they will be safe from the bombardment. However, the facility was bombed and we received 34 patients from that area. And just to further demonstrate how we are witnessing violence across South Sudan, in November last year, a village on the Sobad called Adong was attacked, and more than 80 people were killed in this village. And in the hospital we support, Malagal Teaching and Referral Hospital, we received 49 wounded patients from Adong. Among these patients, we had 3 children, 7 elderly men over the age of 60, and 19 women. One pregnant woman went into labor upon arrival at the hospital. Of course, her child did not survive at the delivery. And the largest mass casualty incident we experienced in March this year was when we received 84 wounded patients at Ahmed Bek Hospital in Abyei after an attack in a Dinka community. Among the 84 were women, children, and the elderly. These are not isolated emergencies. They reflect a pattern of escalating violence that is overwhelming communities. And it is putting a lot of pressure on the already fragile healthcare system in South Sudan. Apart from all this we have seen, we have also responded to 5 different mass casualty incidents whereby large number of people were affected by violence, and we received huge number of patients in our various hospitals we support in South Sudan. And as we speak about this violence, the humanitarian needs are sharply increasing, while international aid and support are decreasing. This is an extremely dangerous moment to scale back humanitarian assistance in South Sudan. This situation we are talking about is likely to deteriorate further throughout 2026, particularly in the conflict and hard-to-reach areas. We have experienced a lot of funding cuts across South Sudan. And these cuts are going to have irreversible consequences for the civilians who are already struggling to survive. MSF is urging donors to maintain their funding commitments and humanitarian presence in South Sudan. We are also calling on the United Nations and humanitarian actors to urgently scale up and adapt their response to reflect the realities of the conflict. We have seen communities trapped in swamps, whereby to reach them is not easy. And some communities have to escape violence to reach to a safe ground, arriving with severely malnourished children in those areas. More agile and flexible and principled humanitarian approach are urgently needed, especially in the areas outside government control, to ensure that the communities are not left without healthcare and essential assistance. Thank you.
Thank you very much, Zakaria, for sharing those important first-hand insights from Upper Nile and for highlighting the devastating consequences of the conflict and ongoing violence that we're having issues with access to healthcare for communities across South Sudan. I'd like to now for us to hear from Gul Bacha, who will speak about the increasing challenges humanitarian organizations are facing in reaching people in need, as well as MSF's concerns and calls for explanation regarding attacks affecting civilians, healthcare, and humanitarian operation. Gul.
Thank you. Thank you, Fatuma. And thank you, everyone, for joining the briefing today. Having recently visited South Sudan, I would like to take you through MSF findings on attacks on healthcare facilities in South Sudan, and also the growing restrictions on access, on humanitarian access, and its impact on the population. What I would start with is the overview that what we know so far from the UN report, that since the escalation of violence in Jonglei, around 33 health facilities have been looted or destroyed. And since the beginning of 2025, MSF have been forced to evacuate staff and suspend our activities in 6 locations. Across the country, we have also documented that there are 12 direct attacks on MSF staff and facilities. These are including aerial bombardments, gunfire, looting, destruction of health infrastructure, and abduction of staff. This resulted in estimated 760 people 760,000 people have deprived from healthcare access in the country. What does it mean for overall situation in South Sudan when the healthcare facilities are targeted? How this affect the access of humanitarian actors, and also at the same time the ability of the population to access us in different areas. We know that overall in South Sudan, the healthcare is already a challenging aspect for the people, because there are very limited healthcare facilities available. And within this, when MSF is operating with large hospital like Lenkian, like Old Fangak, where we were providing healthcare in all aspects to the communities, and also onward referrals for different tertiary cares, from those locations were fully bombarded. During 2025, in 3rd of May 2025, our facility in Old Fangak was bombed. And then later on in 3rd of February 2026, this year, our facility in Lenkian was also bombed. And these facilities are permanently closed since then. In Lenkian, and also as my colleague Abdullah has mentioned about Akobo, the healthcare facilities were fully destroyed, were fully looted. When we went back there is nothing in place that could allow us to reactivate and to reestablish any healthcare in those places. So with the level of destructions that we have faced in our facilities, and the level of targeting that has been done against the humanitarian organization, against the healthcare facilities, against its staff, against the patients, is not acceptable. We believe that with the repeated attacks and forced closure in Ulang, Old Fangak, Lenkian, and Akobo, there are now no surgical services available across large part of the opposition held control area in the country. Now, for what MSF is demanding at this stage is, MSF is deeply concerned for these attacks against the healthcare facilities, and we are calling on the government of South Sudan to provide clear, transparent, explanation for the bombing of our facilities, of our hospitals in Olfangak and in Linkian. These incidents cannot go unaddressed. Medical facilities must never be a target. We are also calling on all parties to the conflict to provide concrete and verifiable guarantees that healthcare facilities, medical supplies, patient, and healthcare workers will be protected at all times. When I go through the process of what happened to us in South Sudan since the escalation of violence, one of the big examples that I can give you from Linkian, that in December, when there was escalation, MSF was asked to evacuate our staff from Linkian. While we were running more than 70 beds facility with full capacities with patients and staff, and while the humanitarian needs were the most at the time when the conflict was happening, we were forced to evacuate our relocatable staff, but we still decided that we will continue our operations with the locally recruited staff in Linkian. With 290 locally recruited staff committed to continue the health services in Linkian, we could not send a single supply to them for the whole 1 month from the beginning of January until the end of January, while they kept treating patients without enough medication, and they had to turn back the patients. It was very painful for me also, being responsible for South Sudan, that the staff is calling me saying that we are receiving patients, but we don't have medicines, while we are not able to airlift supplies from Juba to Linkian because we are not allowed to access Linkian. We had more than 20 critical patients in the facility who were requiring referral. And on everyday basis, every night, we had sleepless nights thinking that people are dying. These are preventable deaths. We can easily airlift them to a tertiary facility where they could be easily treated. We could not. Unfortunately, we lost patients in the facility. It was very difficult for all of us to see that happening in front of our eyes. Our staff in Linkian was going through this difficult time, while with the limited resources, they could still continue their activities. And that was also not allowed. And at the end, we were forced to close that hospital because the hospital was bombed. And with bombing of that facility, then with the full looting of the Linkian facility, we were not allowed to continue that service. And our staff had to flee for their life. And the communities and the civilians, what they went through is the access problem that we faced in Yatem, which is around 16 kilometers from the north of Linkian. Most of the population who were fleeing for their life were moving in that direction and also towards Twil. But there were elderly ones, there were pregnant women, there were children who got stranded in the middle. They could not walk through the swamps. And we had more than 60 staff from Linkian who was also accompanying them. They had some medications taken from the facility when they were leaving. They were still continuing treating those patients. But then the most vulnerable who were dying in front of them, they kept calling us that we need help. We kept asking for permission. We were not given any permission to reach Niatem, while we did all the explores and assessment that we can access Niatem if we would be allowed to. And we can go there and we can support that group of population. More than 58 deaths has been reported from Niatem since then. Who is responsible for it? Access is a right, and delay with access can result into loss of life. And the access permissions should not be linked with all the bureaucratic processes that are in place. We request as MSF that unhindered humanitarian access is essential for the life-saving activities that we are continuing in South Sudan. Now, few things that I would like to mention. We are calling on all parties of the conflict to guarantee unhindered, sustained, and principled humanitarian access. Access must not be conditional. It must be guaranteed. Because when access is blocked, people do not wait for permissions. They die from injuries and illness that are entirely treatable. At the same time, aid must never be instrumentalized or used as a tool of control. Attempts to direct humanitarian assistance towards away from specific areas undermine neutrality, compromise impartiality, and ultimately deprive civilians of life-saving support. Humanitarian principles are not optional. They are what keep assistance possible for people and also for the most vulnerable. Because in our experience, we have seen that there has been instrumentalization of humanitarian aid, and we would like to demand the respect to the humanitarian principle of neutrality and impartiality to allow us to reach the most vulnerable and continue supporting them. Because we have some limited means, but we are able to reach them, but we have a lot of difficulties to reach this population and save more lives that we can. Thank you.
Thank you very much, Gul, for setting out these critical findings and for the important perspective of your recent visit to Jonglei in South Sudan. We've had across all speakers today something that is very, very consistent and deeply concerning picture. Escalating violence, repeated attacks on civilians, and repeated displacements, attacks on healthcare, shrinking humanitarian access, and the very moment like needs arise, then people are displaced again and again and again. We will now return to Abdallah, who will close this briefing with an outline of our key messages and calls to action.
Thank you very much, colleagues. Thank you, Fatuma. I would like to remind you the content, some of the violations that we observed in the our teams observed on the ground and that are contained in the report: aerial bombardment of healthcare facilities, deliberate killing, forced displacement, abduction of civilians, widespread violence. Those are the core incidents that we observe. I would like to go back to the calls that MSF is doing. We repeatedly, my colleagues repeatedly mentioned the question of normalization of attacks on healthcare, attack in hospitals, loot in hospitals, attack in ambulances, and so on. We would like to request a stop to attacking civilian infrastructures, including health facilities. We also would like to ask, as my colleague Gul has mentioned, a response from the government of South Sudan regarding the hospital of Al Fangak that was attacked in May 2025, and the hospital of Lankien as well, that was attacked. We are seeking an explanation of the nature of this and what the government of South Sudan, what's the account of the government of South Sudan regarding these violations. We would not like this to be the normal in South Sudan, that healthcare facilities are systematically dismantled, especially in the areas affected by the conflict, as the so-called opposition held areas. We also would like to highlight the problem of access, the question of ultimatums that are provided to civilians to leave, that totally incapacitates aid in conflict-affected areas has to stop. We would like also to request all parties to stop instrumentalizing aid, asking humanitarian organizations to work in their areas to provide a constant administrative demands that asks us to go to areas where population is not present, where one party is controlling. So this violates the impartiality and the independence of humanitarian aid, and we would like the parties to stop those demands. We would like also to remind the looting and the dismantling of healthcare facilities and assistance in general, especially the looting of supplies, to be looked at. We would like also to remind the little attention that South Sudan gets, despite all the suffering and the problems that my colleagues have today outlined here, that we are asking not only the government of South Sudan, but all the actors that are interested in this conflict to provide, to scale up assistance for the population. It's a movement in South Sudan that, for what we have observed in the last 1.5 years, is the first time we see such a suffering since 2018. And we would like this to be highlighted and talked about. And finally, this is a report of witnessing. We witness the suffering of the civilians. We witness the suffering of our own staff, our patients, civilians who are fleeing. And so this is an account also to expose what we see on the ground. Thank you very much.
Thank you to all the speakers and to everyone joining us online today. What we've had today is concerning. With these closing words from Abdallah, we will conclude the first part of the event, and now we open floors to questions from the press. Please don't forget to say your full name and the name of your media organization, or type it in. I think we already have one question from Caleb from the BBC. I will hand this question to Gul. What is the scale of malnutrition in South Sudan at the moment and the contributing factors? Tens of thousands of people were reported to have migrated to neighboring countries, particularly Ethiopia. What's the latest on that? Yes, please go on.
Thank you. Thank you for asking this question. I think I would try to address it as much as with my knowledge. I would start from what is happening in Ethiopia for South Sudanese refugees when they are crossing the border. MSF is working on Ethiopian border side of South Sudan in Gambela. And we have also sent our team to Matar, which is the closest place, Kankan, to the border areas with South Sudan, where most of the people can cross the border. But there are many difficulties that the refugees are still facing when they cross the border and when they move within Ethiopia towards Gambela. And there are a lot of problems that they're also facing in terms of registrations, etc., in the country there. We see that what my colleague Abdullah has mentioned, reportedly 100,000 who could cross the border, but then could not move further into the Ethiopian side of Gambela for many reasons. And this did not allow us as humanitarian organization also to support them closer to the border areas when they cross from Akobo. But as long as it is related to Gambela situation, we know that people who could cross and who could take this difficult journey from the border up to the Gambela side of Ethiopia, they come in a very, very dire situation. We are seeing increased number of malnutrition. We are seeing also a lack of shelters, lack of funding from the humanitarian side to support them in Gambela side. So that is one of our concern. We are upscaling our response there. We are there in Matar. And we are looking at the situation, but we also see that the numbers of refugees coming to Ethiopia are relatively low, comparing the one who could cross the immediate border point to Tiagrol. Now, when I come back to the overall malnutrition situation in South Sudan, of course, we know there are pre-existing malnutrition problems in South Sudan. Food security is a major concern. On top of that, the conflict. And if I would give you an example of what we are seeing in Chuil, where the displacement has happened, it is the numbers that we see are beyond the emergency threshold. The GAM, SAM, and MAM rates are beyond the emergency threshold, and we are trying our best to meet the needs of those populations, but this is not only the facility-based care that could cover it. There is a lot more need than that for the food security, for the food provision to the different groups of children, to the pregnant and breastfeeding women in the country that we see is lacking. And with the reduced funding, we see the impact on the food distribution in different areas, resulting into further deterioration in the number of malnutritions that we see in our facilities there. I can just generally comment on that one without getting into more specifics, but clearly the malnutrition situation is alarming. With all the access constraints that we see, with all the funding constraints that we see, and also with the food security problems, and also the climate crisis and the flooding, etc., is the compounding factors for malnutrition in the country.
Thank you, Gul. I'd like Abdallah to add a little bit on that, on the repeated displacement, particularly in this area.
Thank you, Gul. I think it's Gul has touched that the population that was fleeing from Akobo, they crossed the border to Ethiopia, and they have been in Tiargol. We were visited. Tiargol is a town on the border, right on the border, The population were not able to go further. Since the last weeks, we are observing that they are actually going back to South Sudan. So we don't have exact figures in terms of how many people cross the border back to South Sudan, but we do know that it's a very significant number of people that were blocked at this border town now going back to Akobo. And of course, it's a moment of that the population, of course, got some confidence that they could go back to their homes. I wanted to highlight the question of the repeated displacement. It's really remarkable to see that families that were living in Nierol County that were coming to Akobo, then they go to Ethiopia, now they're coming back to South Sudan. You can imagine families, women, children, elderly that have been going through this kind of situation. And still they have the uncertainty, because it doesn't that they're going back to South Sudan doesn't mean that there is a beast that came back. But people are quite pragmatic, and of course, whenever there is a lull in the conflict, they try to see what is left in their homes. And so that's what we observe in South Sudan. We have anecdotes, even though we have a team there in Akobo right now doing providing a response to this population. It's a very early stage, but for me, one of the main concerns remains malnutrition, definitely. And of course, there are organizations that are trying to scale up, but it's quite early to say what is the figure at this moment.
Thank you very much, Abdallah, for that. We have two questions from Sharon Nakola from China Daily, and I will give the first question to Helen. To what extent has the reduction in international humanitarian funding, including cuts or withdrawal of US aid, affected MSF's ability to respond to the escalating humanitarian needs in South Sudan, particularly in healthcare, nutrition, and emergency services?
Thanks for the question. So as colleagues have said, I think this reduction in funding is coming at a time when needs are escalating. And already you had a very low baseline of health services across South Sudan. Many health facilities have been non-functional or struggling with staff, medical supplies. 80% of health services are dependent on international actors in South Sudan. And this is before the escalation in conflict. I think what we're seeing now is this escalation in violence, repeated displacement of populations is adding kind of increased access challenges, increased vulnerabilities at a time when healthcare was already low, and funding cuts are only going to exacerbate that more. So I think you have to look at funding cuts in the context of an evolving crisis with many different factors happening at the same time in South Sudan.
Thank you, Helen. Thank you, Helen. The second question is for Abdallah. Given the ongoing conflict, displacement, and fragile health system in South Sudan, how concerned is MSF about the risk of Ebola or other infectious disease outbreaks spreading or going undetected amid the insecurity?
Thank you very much. That's really a very important question. As for background, there is an outbreak of Ebola that's going on in Democratic Republic of Congo, and also cases detected in Uganda. MSF is quite concerned, of course. We are on daily basis dealing with infectious diseases in South Sudan, from measles, cholera, and Ebola is one of the, of course, infectious diseases that we are trying to prepare for in South Sudan. Until today, there are no confirmed cases, but our teams are preparing for any eventuality with the Minister of Health of South Sudan, with the World Health Organization, etc. One thing that I would like to highlight is the areas that are bordering Congo are areas that we have extreme level of challenge to access outside main towns. And this has been the case because of kidnappings of the health workers that you might see in the report. It's one of the main challenges that our teams cannot leave. For example, the town of Yei. We worked in Marobo before. We have been unable to easily access on the road because there are frequent incidents of health workers being snatched, kidnapped, and this is a big concern for us. We are in contact with the different actors that are controlling the areas in the Equatorias to facilitate access, but it's a big concern for us. And but in terms of the preparation, we are following the situation on the neighboring countries.
You. Okay, I was on mute. Sorry. Thank you very much, Abdallah, for that. We don't have any more questions from. Oh, there's one last question. Sorry. The question is back to Abdallah. So, how is your assessment of South Sudan's health system's capability to deal with an Ebola outbreak should it come to this?
I think it's a very difficult question. Definitely, in terms of emergency response, I think it would be largely into external support. As you know, most of the countries that are facing this disease that overwhelms community, it's not only the health system that's capable, at least in our experience. It needs a lot of international mobilization and support. So it's difficult to say today an assessment of health system, but it's really fragile. And for me, all the descriptions that we have been doing today regarding armed conflict, difficulty of access, and a poor surveillance in some of the areas to know detect cases, it is indeed a big challenge. But it's we hope that it doesn't even reach South Sudan, but we are preparing for worst.
Thank you very much, Abdullah, for that. There are no more questions online, so we can close this press briefing. I'd encourage the press, if you'd like an interview with any of our panelists, to contact John Riaga and Wamboi Gisheru to organize interviews for the people on our panel and others. Thank you very much, everybody. Thank you very much to the press, and please speak about South Sudan. Thank you.